I'm going to go ahead and get started. What we're going to do first is I'm going to log into my DSM. Why don't you tell me by show of hands, how many of us have a DSM account? Just show me, just raise your hand if you have a DSM account. Okay, the vast majority of us have a DSM account. And if you are slow in raising your hand and you have one, that's okay. Just tells me that most of us are DSM users. I do get a lot of questions about what is a DSM account and how do I get one. DSM is of course administrated by the Healthy Kynect, and my little hand is up here in the corner of my little spotlight. Healthy Kynect is a website where you would go to sign up for DSM address, and you have different levels and options through them. I've asked them, information so I could prepare for this. I do know that every one of our DSM accounts, no matter what level we are at or how we have joined them, does have the feature of sending to non-DSM addresses. So if you have one, you can do this too. Okay. I'm going to log in first. Apologize if some of this is a little tedious, but okay. So here's my DSM email. And what I'm going to do first is I'm going to demonstrate for you how to send one to a non-DSM address and just give you some little hints. I will go, okay, no worries. Thanks for signing in. If you're here double names, it's okay. Just if you want to tell me who your second name is, that's great too. And I know everybody's here and it's all good. I'm going to compose a very basic email to a non-DSM address. So I hit the little compose. And because I've done this before to practice, the system will remember a non-DSM email address. So our training Gmail is AK, and then it comes up. And you can see a lot of other folks' DSM address. I'm not going to send to them. I'm just going to send to this one because I've tried it before, aksdstraining@gmail.com. So that's our Gmail account. We really don't use it to do work with state stuff. So, don't send us email there. Occasionally, if we can't get it any other way, I might ask you to, but we just keep it for our Google stuff that we do with our training. But it's a regular Gmail account. Something to remember at this point is make sure the non-DSM address that you have, email address for the person that you want to receive your DSM email, which contains either private health information in the body of the email or in the attachment, make sure that it's correct. If it is not correct, what will happen is you'll enter it and then you'll look at it and you'll say, oh, that wasn't right. And you'll try it again and it'll be kind of similar. So it will save both, like the incorrect attempt and the correct address. And so next time, if you're like me, you try to do it fast, you'll look at the first couple letters that were probably right and you might pick the wrong one. So just make sure, give it a double check and make sure that the address is correct, because you want to make sure to send this information to an address that you trust, the person who is going to receive it, who is not a DSM account holder, okay? Could be two families or an individual, somebody who you trust who has a direct need to know this private health information. We'll talk a little bit about that in just a second. So I'm just going to put a random subject here. I've been doing a lot of test here, so you can see it remembering my test email. So test email 3. And the body is just going to say test email 3. And I guess just pretend that this contains PHI. I'll just put PHI private. Learn how to spell, right? Private health info, just to have some text in there. And then I'm going to put in an attachment. And this is the document that we're actually going to look at in just a second. So we're going to attach that, and as if this had PHI on it. Could be a document, could be a plan, could be something that needs to be signed by the individual, something like that. So I added the attachment. You can see it's there. It says, you know, the title of the attachment. And then I'm going to hit send. And it will send, and it says sent successfully. And at this point, I'm going to let it do its thing. And because it's sending, it takes a minute or two for it to get to the next step. And I'm going to call up the document about what is PHI. Okay. So this is a document that I did put in your handouts. I am very happy to send this to you by email too, in case your device doesn't pick it up or doesn't like it, or maybe you don't have PDF on your tablet or your phone. PDF capability, that's okay. PHI is individually identifiable health information. Anything that is recorded or transmitted orally or electronically or has a physical, you know, like paper, okay? It's under our HIPAA rules, which include the transmission of private health information via electronic means, okay? So what it is something that would be created and received by healthcare entities and relates to past, present, or future physical or mental health or condition of an individual, provision of healthcare to the person, or payment of healthcare for healthcare to the person or to the entity that serves them. Okay. So basically, because we can infer for the people we serve that they're in our programs because they experience health conditions, everything that we do within our services is related to that. Within that is there's an economic classification that our folks who have Medicaid come under as well. So that's another kind of like private information inference that you can make about a person's information. Because of that, when I teach it, basically everything about the person that can identify those things is considered PHI. All right, so let's take a look at the examples of PHI. They do include, but are not limited to, the items on this list. All right, shoot me your questions if you have them as we go. All right, so what is PHI? Certainly a person's name is PHI. Okay, so when it comes to transactions that involve specific private health information about that person, their name is PHI. Now, this isn't a little different than, you know, name and address as being part of a member of a community. We're not going that far as the person, you know, voluntarily saying, hey, my name is Kara. That's not, you know, where we're at here. We're more so talking about, you know, documents that are sent over email, and specifically information related to the person's health condition, you know, or economic status or behavioral health condition. That's private information. Addresses, okay, so addresses relates to location. Any part of an address except for the first 3 digits of the zip code or the state that the person lives in is private health information. So many times you might hear about making reports, and, you know, SDS creates aggregate reports about, you know, outcomes for very large groups of people. Things like the first 3 digits of a zip code could generally qualify an area in a state. Of course, a state qualifies a state. Those are higher level reports, but more specific information like that, like their actual physical address and things like that, that is going to be PHI. Okay, date and place of birth, date of death, elements of dates for events except for the year, their age, Age aggregates can be general, like if it just says younger than 21 or older than 90. Again, not so common in our world in terms of exchanging information with SDS or amongst providers or to families or from families, that type of thing. A person's race, marital status, phone number, fax number, email address. You can read these. I don't have to read them all out. I'm going to click down a little bit here. Social security number, medical record numbers are like a person's Medicaid number. That's any number associated with a medical record. They may be other numbers associated with medical records that could come under this, possibly. Health plan, beneficiary, military rank, civilian rank, name of relatives, account numbers, license numbers, certificate numbers, vehicle ID numbers, device ID numbers, their IP address, their URL perhaps, biometrics, finger and voice prints, full face photographic images and anything comparable, or any other unique identifying number, characteristic, or code. So this is a general list. A lot of these things are pretty obvious that they would be private health information. Some of them may be surprising. You might have questions, but this is what PHI is, and our HIPAA assurance when we become providers, and even within our SDS and other DHSS entities that work with private health information, need to follow HIPAA, which in a nutshell is keeping private health information private, released at the permission of the person with the release of information, the owner of that information, and if they have a representative, like a guardian or a POA, that person too can help them decide what to share. The least amount of information necessary to do the work for the person. In some cases, it's a lot of information, like a whole plan of care. That would be something that some folks we interact with would need to get. Then there's other interactions that are, if a care coordinator is asking another provider, hey, my person is interested in getting a service from you. I have a release of information, and I need to give it to you for permission to talk about her case or his case, and there are certain things that we want to know about you before she chooses you, that type of thing. Okay, that is also under HIPAA. You would want to keep your exchange of information one-to-one, meaning like we wouldn't send group emails with information out. We can't do that over DSM. I'll show you that, or I'll at least, I don't have another address to try to do a group email to, but I'll talk about it. We wouldn't send this type of information over a generic email, like from your Outlook or other unprotected, unencrypted source. Some of you may be working with encrypted email already with a different method. Okay, but that I do not know. I can't speak to it. I have to just talk today about DSM. Okay, so what I have here is I have a direct message that I've sent, and it says message delivery needs your attention. All right, so I am going to go ahead and click on that, open it, and it says message not delivered because I sent it to a non-DSM address. So what do I do? The message has not been delivered. It says I attempted to send a message over direct mail network to a recipient that does not have a secure DSM address that we can locate. So what can I do? What it says here, let me rearrange my other screen a little bit here so I can grab things a little easier. So what can I do about this? I have a couple choices. If I made a mistake, I can do nothing. If I trust the recipient, I can send it using the out-of-network secure email service. Okay, so what this means is that I verify that this address is the one I meant to send it to, and I'm sending PHI to this address under the rules of HIPAA and requirements of HIPAA regarding our regulations, our local, and of course our national regulations which govern that. And that's really what that little blurb says there, where it says click here. So if I want to proceed, I click here, and it opens up a new tab, as you can see up there. And then it says a notification has been sent. And it says thank you. So that means that I attempted to send it, then I verified that it was the right address, and I intended to send that, and I chose that option to send to that non-DSM. And now it's telling me that a notification has been sent. Okay, I can click out of that and just go back to my inbox. And I think that that was for the first one I sent. I tested it really quick right before I started today. So I'm going to do it again for you, and I'll show you in my Gmail what happened. And what this tells me is that I have to complete this process before I can send another non-DSM address. So it's kind of a one at a time thing. Okay, it says needs my attention. Here's what it says so you can see it again. What are my options? Do nothing. Message won't be delivered. You're okay. Maybe if you didn't mean to, it's all good, right? But hey, I wanted to send that. I really did want to send that message to that non-DSM address. So I'm going to click here because I am confident in the rules that it stated that it's HIPAA compliant. Okay. And I can click out of that. It told me that it was sent, and just go back to my inbox. And you can kind of see that, you know, I've done this a few times and demonstrated it. Okay. Now I'm going to go over to my Gmail. Here's my Gmail, just making sure that y'all can see it. So because I keep having it come from the same address, it kind of comes in a big one. And Gmail doesn't list them out. You just click on the one. It's a string in their eyes, if you will. So what it does is it sends two emails, and I'm just going to use these top two. It sends two emails, and one of them has the password, and the other one has a little message. So the top two was the last exchange that I sent to myself from DSM. Okay. All right, so it says delivery pending, and here's your password. You can see that, right? This one says delivery pending, the top one. The bottom one says here's your password. This is what your person would get, like your family or whoever, okay? Whoever you're sending to who is not the DSM member, if you will. All right, so what they want to do is they want to go ahead and copy that little password. Oh, see, it's hard to do a little bit for me. Copy that little password, and then go up to the top one, and it says the notice was generated from the direct mail system from Kara. Kara sent you the message because it may contain protected health information. We couldn't find a direct address for you. However, the sender has determined that they trust you to handle the content of the email message as required by HIPAA and other relevant regulations. So let me get my little bouncing ball again. To securely access and retrieve the message, please click here and then enter the password that you will receive in an accompanying email. So I got two. The bottom one has the password. Okay. And then it says you will be able to view the message and reply over the next 15 days. So for 15 days, if you and your email recipient need to exchange information containing PHI, you can do that. And the person can use that link to send more emails and reply to you. It kind of creates a little private inbox for 15 days. and then it expires. So if you need to have more than 15 days, then you're going to have to send them another email, but that's okay because they're, you know, they're going to get another email, then they would have another 15 days to respond, and maybe they don't need that much, maybe it's right away, whatever. So I copied my password, and I'm going to pick up that email that was sent from the private address, and I'm going to paste the password right here, right? And I'm going to log in. And there's my little inbox that was made just for me by the private DSM, the DSM email. And I can open it, and I can open the attachment. And you see it makes new tabs and stuff. It's kind of just telling me, it arranges it so I can see it. I can do what I want with this. I can download it, I can print it, whatever I want. I'm just going to close it right now for purpose of our demonstration. But that is basically how it works. And then I can reply to it. If I use the the little envelope, I can reply to it, and I can add, let's try that. I can add a document. So let's just find something, maybe that, for whatever reason, pretend it had PHI in it, upload, and send. All right, I'll go back to my inbox. And that's basically how it works. So this is the Gmail inbox, and this is our secure out-of-network sent DSM for a non-DSM address. Okay, what are your questions at this point? I'll go ahead and freeze on my screen and give you a few minutes to think about it. What are your questions? Is this helpful information, or is this new information for you? What are your thoughts? I'll be quiet here for a second. Okay, good questions coming in. Let me see if I can help with a few of these. Helpful, never knew we could do it. Okay, cool. I'm glad that that now you know. You should experiment a little bit, send some things that aren't really PHI and test it out. That's okay. Are these out-of-network emails archived for the DSM sender? Let's go back to our DSM. See, on my computer, they tell me the different browsers that are up down on the bottom. So this is the one, this little one here is my secure out of network. And this one was my DSM. So let's see what it says. Test email, okay. are they archived? That's a good question. Does anybody know? Trainers, have you tried this? The archive part?
I haven't tried that. Cena.
Okay. Actually, you know what? I can see that it is archived in the sent. Let me show you that. I just need to make it small because there's all kinds of other things archived in my sent that would be PHI. So I'm going to just make it small and I'll show you like this. So in my sent, it's archived. See here? Test email 3. 2 was the one I did before everybody joined me. Test email 3 was the one that I just did. So it is in your sent. Good question. All right. What else? What else? Let me see what else we have. Is the size of the attachments the same through this system as to another DSM address? My best answer is yes. I have checked with our InPriva Healthy Kynect. Yes. No questions, just need to run it back and forth and try. New information to me? It's new information to a lot of us. It was new to me. How do you get the notice when you have to click proceed every time? Does the recipient have to get using a password? They do. The recipient gets 2 emails like boom, boom, right? And that is on their in their Gmail. Let me see if I can find that for you. Hang on. Maybe it got to a different place here. When they pick it up in their Gmail, it actually is a 2 emails that come and they have to you know, get a password from the second one and get the link to go to it from the first one. All right, a couple people are asking us to run through it again. I can do that. I have so much open at the bottom. I'm having a hard time finding where the Gmail was that just looks like the Gmail, but I'll keep looking and we'll get to that. All right. I can also do it again. I would be happy to. How do you get notifications sent to your work email? If you go to settings, the little gear at the bottom corner, let's do that. This is a little off topic, but it's helpful too. Right down here, settings, and it says manage folders. And then you go to notifications.
Hey, are you locked up because we're not seeing your
Oops,
screen change?
sorry. Okay. So that was the gear in the lower corner, settings, and then notifications. Let's see here. Let me see if I can do that again.
Just back yourself out and then come back in.
Yep. Thank you, training team. Okay. Your little gear, and I could go back one, I guess. All right. This was my inbox, right? So down here, grab the little spot, is a little gear. So we click on that and it says manage folders. Then you select account, which one, I guess it's the inbox we want to do. Well, they're all selected, but can we unselect them? Maybe not. That's okay. If not, that's okay. Spam, maybe we don't want notifications of spam sent. Notifications, and add up to 20 addresses to be notified when direct mail arrives. So if you want to have a notification go to your work address, that's where you would put it there. Okay.
So I do. I mean, Kara, I have mine set to go to my Cena Fisher at
Okay,
alaska.gov right
cool. Let's
there.
do that. Why not?
Which means I do see the messages coming in. I just kind of forget sometimes to go and actually look at them.
There. I add to myself. So that's how you do it. And you can probably just back out because it's already enabled, right? You just go back, and that's my main inbox place. Okay, thank you, Sina. Comment says, it took a long time for me to get both messages. The password came first, so there was no access to the email. That would be confusing for people. Is that common? I think what's happening is Gmail is weird. If you use Gmail, it's all in one thread. It could just be speeds of messages coming. It could be confusing, but just let people know that there's two emails. One of them gives you the link to get there, and the other one has the password. Yep, and they do have to keep using that password. So whatever, their regular email address that you sent to, they can go back to that and they can pick up that password for the duration of the days that they, are going to want to send something back to you or access it. Yep. Are we able to send DSM emails to other email accounts besides Gmail? Yes, you can send them to any email. I'm just using Gmail because I have one easy to show you. That's all. Okay. Okay, does this need to be agency-wide, such as sending plans to each person reviewing within an agency? Well, when it comes to PHI, you want to make sure that you have the information that's necessary to do the work sent to directly to who needs to know. Okay, so we cannot create group emails using DSM. As a matter of fact, you can send only to two non-DSM addresses at a time if you use CC. Okay, so there's only two. We can't make a big group email using DSM. And that's on purpose because, you want to make sure that, your information is kept private. The retriever can only access an email using a computer and not a phone. That is my understanding. Question says, if I communicate not using DSM and we use only initials, if there's no other way to put all the other sensitive information we're sharing together, is that still a violation of HIPAA? So according to our document here, what is PHI? Initials would be part of private information. So, I mean, this part of the discussion is like, if folks have used initials or you're currently using initials, just remember that there's other pieces around every story that I can't know. So when I say that, folks might be thinking, oh my goodness, every time I've done initials, I've violated HIPAA. That may or may not be the case because you might have had an ROI in place already. You may have sent it to another entity that has HIPAA compliance. You might have used a secure email. Generally, I'm just here to define it. Okay, I'm not here to qualify every single thing that has or hasn't been done at all, because there are always circumstances. But as a best practice, just know that initials are also on this list. And so
Sarah,
there are ways. Yeah, yes. Hello.
I have a question on my side. Okay, I think Cena just answered it.
Go ahead.
Okay, sorry about that. So the question is, I am concerned about the Gmail account. What if my husband is checking my Gmail account? Would he be able to see what's in my DSM?
Um, If he checks your Gmail account, he has access to your Gmail account, and he gets the email that a DSM user sent and opens it and sees the link and the password and uses it, he's going to just get that message that was sent, not a whole DSM account. It makes a private link for just that one message. It doesn't give people access to your whole DSM account, just the one message. It's like a little tiny inbox to that one trusted non-DSM account, be it Gmail or Yahoo or whatever. It's just that one exchange. It puts a box around that one exchange that keeps it private. But if somebody else has the, access to it, then they'll be able to pick it up. But it's not a whole DSM visual. They're not going to see the whole DSM account of the sender. No.
Okay. Thank you.
You're welcome.
Question is, have they tested that to make sure?
I sort of just did, because I'll demonstrate it again, because when I picked it up from my Gmail, I could only access what was sent, not the whole account of the sender. I'll show us again. Okay, so maybe it'll make sense. Okay, better sense. I know it's confusing, so I apologize for that. I'll show us again. Okay, it'll just take a second. You can send information that's via unsecure email. Instead of using initials, you're pretty much only going to be talking about one person. You could use generic language like your client or your loved one or something like that. You wouldn't have to use initials. I definitely don't want people to, have, a ton of concerns over having used initials and things like that. Again, I can't qualify every single thing as or as not, a HIPAA violation, if you will. Today, I'm just defining best practices and definitions of HIPAA protected information. Yes, you can only, it says only to two non-DSM accounts using BCC. Yes, or even copy, only two. Non-DSM accounts. We can't send to a whole bunch of them, just two at the most. What if a guardian requests to send them through regular email? Does the care coordinator still need to do it this way? Well, I guess my best answer on this is that we could explain to our person that we have a way to send information that will keep their loved ones or their wards information private. And could we try doing it that way, because you will be able to pick it up with your regular email. I think folks probably do that because they really didn't know of an alternative. And so if we have it, listed, if we have it there as an actual option, I believe we should offer it to people and give it a try, because it's part of our duty to keep information private. When you think about it, people do other things that can't contain private information, like health portals and messages to your doctor. You go on and, have a username and a password and you put it in, and it's a little different. This is just a password sent by a private, DSM. It's just that. But we should offer it to folks, and that is my best answer. Just give it a try. It's a lot better for you because you're compliant, and for the person because their information is compliant. I mean, think about like if people do things like, get a mortgage online, all that information that gets signed and everything, they just give you a private link. It's not expected to come over regular email, and regular email, believe it or not, non-encrypted email flies all over the place and goes to different servers and stays on them for indeterminate amounts of time. And lots of information that's private health information is valuable information to people who would use it for the wrong purposes. And there's all kinds of things like that and scams and things that people do, like getting prescriptions and getting identities and things like that. So that kind of information is like super, sought after, if you will. Okay. What other questions? So what should the receiver do with the email after they open it? Is it a violation of HIPAA to have it sit unsecured in their email account? It actually remains in the secure server and not listed on their account. If there are attachments, then they download them and do what they will with them, but it doesn't sit in their account, literally. They have to still use that link and password to get in. You could use it with family members. You could use it with agencies, advocates, and people like that. I should add, I'm not going from A to Z with HIPAA interpretation and things like that, but we should always have a release of information for when we send, private health information. Now, care coordinators sending things to SDS, yeah, you have that. That gets signed out in the first packet, that's done. But when you are sending to others, either to send information to a person or a family or another provider that doesn't have a DSM address, then this is what you want to use. Okay, so last comment here says, I've heard that faxing is not encrypted. Faxing and mailing by regular paper mail is still considered, private. That is still, those technologies or non-technologies, if you will. Of course, we know that things can be intercepted and whatever, but it's still considered a safe way to send private information at this time. All right, so let me demonstrate again, okay? Let me demonstrate one more time. I'm going to get rid of this and I'm going to set myself up here and make sure that I've got everything that I need to show you what we're doing here. Hang on just a second while I look around. I'm sorry. I'm kind of looking around aimlessly here. It looks weird, but all right, one more time and then we'll be done. Okay, so this is my DSM. I've logged in. I'm not going to go that far back, but you've logged into your DSM and you're ready to compose a message. And I'm going to send it once again to my Gmail account that we use for training. Don't send us email there. We probably wouldn't look at it for that, but it's handy for this type of demo. And I have sent to it before, so it pops up as a known, or at least just AK is common. So everything that says AK is going to pop up. So I'm going to click on that. Make sure that you spelt it right. It will retain the reminder whether it's spelled right or wrong. Test email 4. Right, so test email 4. And I will add an attachment just for example. Open and upload. And my document's going in there. Okay. And then I'm going to send the message. And when I send the message, it says it's sent successfully. And since I sent to a non-DSM address, it's going to give me a bounce back here. And it might take a minute for that to happen, which is kind of normal, but that's okay. We'll keep looking at it. It is doing its thing. Okay, so I'm going to show you, there you go. It says delivery needs attention. It needs me to do something. Okay, so what do I need to do? I'm going to click on that and it says outgoing message not delivered. My options are to do nothing. If it was wrong, no harm, no foul, do nothing and it won't be delivered. If I did want to send it, then I proceed, I click here. And it says a notification has been sent. And so I do have my Gmail up here, and I'm going to bring it into the screen. And it has a lot of things because I've been sending things and practicing here. So Gmail does treat it like it's a big old string, you know, that type of thing. It comes from the same place. But I'm just going to click on the top one. Okay, so I actually get two messages here. Opening it up, I get two messages and it says, to retrieve your message, click here and enter the password that you will receive in an accompanying email. And that was the previous one. Maybe it didn't send it to me yet. I don't know. We'll see. It might be waiting. I just refreshed it. Okay, so I opened up that little 4 there because it was waiting for the second message. Okay, so the first one I got was, hey, Kara, delivery pending. Kara over at SDS sent you something it's a secure email. So the second one, I'm going to have to open up that password. I'm going to copy it. It's a little hard, but copy, click on the link. And so this is where the question was, you know, does it make the person able to see all my DSM? It does not. It just opens up one little box, if you will, where you can exchange for 15 days. So I'm going to put in the password, log in, and there's the email. My test only gave the password, no second email. It may work different with different browsers. You know, I haven't tested this on every single browser that there is. You know, it could be that it works a little differently with different browsers. Okay, that could happen. 15-day question appears to be answered in the body of the delivery pending. Doesn't look like the person will be able to access if they don't get to it within 15 days. It's probably true because it's only going to last for that long. If they didn't get to it, then you'll have to send them a new one. Yeah, if it might be sent to spam. You might have to check the spam or you know, trash maybe, spam. You know, it's kind of a familiar email address to our Gmail here. But you could check that. You could try it. Secure out of network. So it's only that one link. And if you have an exchange between, you know, it'll reside there. If the person does pick it up in 15 days and does send something back, it'll reside there, but it does not, you know, it does not go right back to your personal DSM at all. Okay, so we're up to 3 minutes to the top of the hour. Okay, thank you.